My next guest, I always say, Ponce de Leon didn't find the fountain of youth. My next guest did. Welcome to the show, Dr. Carlos de la Hoz. Before we start, a little bit about you. You're in your history. You were an anesthesiologist. How did you go from that to this wellness, longevity, and pain management world?
Right. Well, I've always been into sport, so that was a big part of it.
Yeah.
And then anesthesia, I did pain management, more focused on acute pain, so hospital setting. And then I had an injury. I had a motorcycle accident. I injured my posterior collateral ligament, had a partial tear. And I didn't want to use traditional methods like corticosteroids or surgery. Mm-hmm. So I was searching, and I felt with this, I found this new technology at that time. I'm talking, 15 years ago. Yeah. And it was PRP, platelet-rich plasma. Super new. And I decided to do it on myself. And it really worked. So that impacted the way that I practice medicine. And I started finding new ways of treating patients for pain with regenerative medicine. So incorporated that into my practice, found that my patients were doing great, and started going more and more into this more natural approach of medicine, more ethical, and then focusing more on longevity. As I started getting older, I started having pain myself, and my friends started having pain. So that kind of triggered everything, and I just went down the rabbit hole. And, here I am, years after, opened a business dedicated to that, very passionate about it. Yeah. So, that's kind of like the story in the summary.
So let's talk, because I've used PRP. When I present it to my friends and people ask me about it, and I think we're still sort of in the early stages of education for people. What exactly is it? And then when would I use PRP?
Completely. So yeah, it's a fairly new technology, and like everything, with these new technologies, it takes years. Mm-hmm. One, for insurances to kind of take over and accept it, and two, for people to really understand what's going on. And we're still finding a lot of things about PRP. So it's platelet-rich plasma. What we do is we concentrate platelets. So we take blood out, we concentrate those platelets, and platelets are full of these granules that have growth factors. Mm-hmm. So what we're trying to do is regenerate tissue, is induce healing. And that's what we do in many of these injuries. No? So patients that have musculoskeletal injuries, for the most part, so muscle, tendon, ligament, cartilage, bone, especially partial tears like rotator cuff. I'm going to say a few that are common: rotator cuff, meniscal tears in the knee, ACL tears, PCL tears, MCL tears, all these things, back pain, neck pain, and also for beauty. So a lot of good things are happening with hair loss, skin rejuvenation. Like a lot of people are talking about vampire facials, for example. Yeah. So injecting it in the face, it promotes production of collagen, so you're not going to age so fast. Right. So beauty applications, we have other for sexual dysfunction. Yeah. They're using it for for stuff like that. So a lot of new ways that we're finding that it actually works. And the sole fact of using PRP, or what we're trying to accomplish here, is induce healing. Instead of stopping inflammation, which has been traditionally what we do when somebody has pain, manage symptoms. No, with this, we're actually healing the patient. Yeah. No? So the patient is going through all those steps towards healing. So it's inflammation, cell proliferation, and then remodeling. These are the 3 steps. So we're able to accomplish that in a natural way, and the patients actually heal.
You always hear about stem cells, and people are either confused or don't know enough about it. And I know, from a personal standpoint, I've had family members who have gone through your stem cell therapy and have gotten amazing results. And just from the results, I'm like, why don't more people do this? And if you can, just explain what happens when you inject someone with stem cells, and what is that process like, and what's happening?
First thing I want to say, the best stem cells are your own.
Right.
No? What we call autologous. Unfortunately, there's some bad players in the industry offering stem cells that are not stem cells. Like, for example, amniotic fluid doesn't have stem cells, it has growth factors. So things like that. I think education is very important. Going to a source that is credible, going to a good doctor that is always going to be ethical and give you the best options, that's the most important thing. Stem cells are cells that we have in our body that they are basically not differentiated. That means that they haven't become muscle, heart. They have the capacity to become a lot of things. Yeah. So when they are put in certain environments, or where some tissue needs to be repaired, they go there, or they're native in that tissue, and then they start releasing signals, what we call medicinal signaling cells. And they also promote this tissue healing. So that's how they work, in a very broad sense. As we age, these cells start decreasing in the body, and that's part of aging.
Right.
That's the reason we age, because we don't have the same capacity to repair and regenerate tissue. So the damage is not being fixed as fast.
Right.
And that's what happens. So we developed the bank to store these cells.
Yeah.
Many people have done it for their kids. When they are born, you get the umbilical cord, you get the cord tissue and the blood in the umbilical cord, and you save it and you store it, and that's full of stem cells.
Right.
Some of the best. The best
Really?
ones are the embryo, but that's unethical.
That's unethical,
We don't
right.
do that. But the second best is this ones. And the third best is ours.
Yeah, right.
We didn't have that possibility.
Right.
So today I store more stem cells, for
Yeah,
example.
I've done it on your
You have
recommendation.
done it as well.
Yeah.
So these cells, you have them there, they don't age another day, and they have the capacity to help you in the future when you need them. And the question is not, will I need them?
Right.
The question is, when will I need them?
Right.
So this is insurance for the future.
Yeah.
Stem cells are the future. We're going to use them for tissue engineering. Transplants are going to be a thing of the past. We're going to be able to use these cells, your own cells, and develop organs.
That's
so this,
amazing.
this is tissue
How,
engineering.
how far do you think we're off from developing my own kidney, right?
We're close. Right now, we're able to develop what we call organelles. So they only have one function. But organs, they have many functions. The kidney has many functions. I want to say between 10 to 15 years,
Okay.
we'll be able to have something that can be implanted and has some functions.
So I started banking mine, I think when I was 45. Let's say I need a kidney transplant when I'm 70. I'm going to get a 45-year-old Dan kidney
Yes.
in me?
Yeah,
That's-
because your
that's
cells are
amazing.
45-year-old.
Yeah, because when we talk about longevity, you and I've had this conversation. It's like, well, look, I'd love to live to 100, but if that means from 82 to 100, I'm in a wheelchair and I am not enjoying life and I'm, in diapers. That's not living, right?
Right,
I want a vibrant. I want when I'm 82 to be like when I was 60, and I think some of this science and technology is going to get there by the time I'm that age.
It is getting there, and we also have a lot of understanding of these longevity pathways. So it's not only stem cells. The stem cells is a part of it. And when we talk about longevity, we talk about what you're saying. It's adding good years to your life. It's
Right.
vitality. No? So there's two concepts: lifespan, which is the amount of years, and
Yeah.
then there's the other concept that we focus on, which is health span.
Right.
So prolonging those years of health.
Yeah.
No? That has to be the focus of people right now. No? If you want to live a long, healthy life.
Yeah.
And we're able to accomplish that. Again, stem cells is part of it, but we also have all these supplements right now
Right.
that have been proven. For example, I'm taking metformin.
Right.
Metformin. People are going to be like, "Oh, are you diabetic?"
By diabetics, right? Yeah.
No, I'm not. But we have a lot of studies right now coming out and research showing that it actually impacts longevity.
That is
It
crazy.
decreases the incidence of cancer.
Of cancer, yeah. That.
So, it makes the cell more efficient in terms of how it utilizes
Yeah.
resources. So the mitochondria, which is the powerhouse of the cells, they're able to work better.
Yeah.
And, this is a number that really what shocked me when I saw it. 40% is the incidence or the possibility that you have of having cancer in your lifetime. You, me, anybody.
Right.
It's a 40% chance.
Wow.
So, yeah, I mean, it's huge, right?
Yeah, it's huge.
You want to decrease that exposure.
Of
You want
course.
to do that. So doing these things, and if I can tell anything to the audience, I'm going to talk about the 4 pillars of anti-aging and
Right.
longevity. And they're going to be exercise more,
Right.
number 1. Eat less, so caloric restriction, intermittent fasting, all these things proven.
Right.
They activate longevity pathways. It makes your cell more efficient. Sleep better. When
Really?
You sleep your 8 hours. I mean, sleep is so important. And also manage stress. Those are the 4 things that you have to be focused
Right.
on.
Even before we get into all this tech, it's the stuff that you can do at home. I always felt our biggest miss during the pandemic was, hey guys, the reason that we're getting such bad results compared to everywhere else, and we have these fantastic technology, doctors, vaccines, stuff like that, is that we're obese. And we don't take care of ourselves. And guys, this is the moment of truth where we got to do all the pillars that you talk about. Reduce stress, exercise regularly, eat right, all these different things, and we missed it.
We're missing it completely.
Yeah.
We need to focus on these things. And nutrition, number 1. We see that if you exercise every day, but if you don't eat right,
It's almost worthless, right?
worthless. If you were to take metformin and not do these other things, so if you take the supplements and you don't do these things,
Yeah, no big deal,
nothing.
right, yeah.
We're not having the same response. So before we talk about supplements, hey, we need to control these 4 pillars. You know?
It's got to be a mind shift because I always feel like we don't have healthcare here. We have sick care, right?
Completely.
And the outcomes is like, look, we'll put you on this drug for the next,
That's
the
it.
rest of your life. You're on a statin, you're on a this, like.
And pharmaceuticals are super happy because they
They're
have
super
a
happy. They
client
love it.
for life. We're
Yep.
talking here about
Right.
business. This is, this is about the customer.
Right.
Talk about that. That's a perfect model. You have
It's a
a
perfect
client for life.
You have a sick client. You
A
want
sick
them
client,
sick.
That's what I mean.
It's
you know,
crazy.
so I don't want to talk about it.
Yeah.
Insurances and all these things.
Right.
I have my own opinion, but let's just say that they don't have the best interest in the individual out there.
This episode is brought to you by Buena Vista Creative, Miami's premier digital marketing agency. Visit buenavistacreative.com for more info on how Buena Vista can help your business increase revenue and create the brand and digital presence it deserves. Video and podcast production, web and app development, search engine and social media marketing, logo creation, outdoor, print, swag, and more. Visit buenavistacreative.com to learn more.
Something I've been reading about recently, it's almost, again, an epidemic of men and testosterone dropping. And where does that come from? Is it the plastics? What is your your reading and whatnot tell you?
A lot of it is nutrition. A lot of it is activity-wise. I mean, we're sitting longer. We're not, we're
Right.
on the couch. We're playing video games, doing all these things that, doing less sports, exposed to pollutants, to carcinogens, to all these substances, radiation, all these things that are going to decrease. And all this electronic life, man. I mean, it has disconnected us, you know?
And the best way to generate more testosterone is obviously exercise, but like working out your big muscle groups, I've heard. Is that true?
Completely. So legs.
You can't skip leg day.
You can't skip leg day. That's a must. You have to do legs. Good nutrition. There's, good. That's going to be the key. If you don't have a good nutrition, that's going to impact your longevity, your testosterone. And also, if you don't sleep, that's when you produce the most testosterone.
Right.
So those things, again, we go back to the same pillars. It's the same thing, over and over and over again. These are affecting not only testosterone in men, but also different hormones, growth hormone. In women, they also cause alterations of sexual hormones, as estrogen, progesterone, all these things.
It's amazing. All these things that, I remember growing up, it was like, don't lift weights, it's going to stunt your growth, you're going to get tight, stuff. And then now you're hearing like, no, well, like, you should be doing cardio, but weight training, because as you get older, you lose, half pound of muscle a year. And obviously your leg and hip training, because you're more likely to die of a broken hip as an old person. So get that area really, really strong. And you're just like, some of these things,
that
man.
concept that if you don't use it, you lose it, that's completely, the truth in the body.
Right.
And like you mentioned, we lose 1 to 2% of muscle mass every year after our 30s. And then we also lose 1% of bone density after our 40s. So we are basically, in an uphill battle here.
Right.
If we don't keep it, we're going to lose all these things. So that's the importance. When people ask me, why do I go to the gym every day?
Yeah.
Well, number one is for
Me
this.
too. It's a mental thing for me. 100%.
Right? That consistency.
Yeah.
What it gives you, that age.
You have to push yourself every day, and a great way to do it is in the gym. I don't want to do it. Well, no, you have to. You signed up to do this. We're going to do it.
And that gives you the possibility to know that you can accomplish things. Right?
Agree. We have to test ourselves every day.
And then the second benefit is that I know that I'm doing something not for today, but for 10 years from now.
Right.
So that investment, that is what is important.
Yeah.
That's the reason to go to the gym.
You turned me on to something. I remember once I got food poisoning, and I felt terrible. And I said, well, why don't I just get an IV? I got an IV, and I felt great right away. And I go, why don't I get more IV treatments? Now it's become a big industry. You do it. Walk me through, because it's not just about getting these great nutrients in your body if you're dehydrated, but you can solve migraine issues, all kinds of stuff. Walk me through sort of IV treatments that people may want to look into.
So, the way we do it in our institute is we usually do a complete blood panel. When I mean a complete blood panel, it's things that your PCP, your primary care, has never done.
Yeah.
We test all these biomarkers, all these things that we know for a fact predispose. We know that if we test them before, we're going to know if you have predisposition to certain diseases. No, that, and we also know for sure what deficiencies you have. Based on that, we target those deficiencies. No, for migraines, there's different things that we can do. One of the things is IVs, because we know that there's certain substances and nutrients and vitamins that can help you with that, to manage pain and all these things. But in general, what you want to do is have a very focused approach when you're doing IVs. Not to do them because, okay, I'm going to just supplement with all these things.
Yeah, I'm going to go party this weekend and help me with my hangover.
It's the same thing as taking, a multivitamin.
Right.
it's not going to hurt, but are you really targeting what you really need?
Right.
You know? My advice to anybody out there
Yeah.
that is looking to, prevent disease, and the key is prevention, is to do blood testing every 3 to 6 months.
Right.
That's how you know. That's how you know, okay, I need to address this issue. 40 to 60% of the population in America is deficient in vitamin D.
Right.
And we don't test this regularly.
Yeah.
So
Another miss during the
that
our
will
lockdown.
tell you,
Right, yeah.
that should tell you. And we know that, for example,
Vitamin
COVID,
vitamin D is very important.
Very important,
Right.
you know?
And it's also a very cheap supplement that you could pick up
Right,
at,
right.
for
But
peanuts.
also you have to know that if you don't have the right levels,
Yeah.
you have to test to make sure that you're in the right levels.
Right.
Too much of vitamin D can also have its negative
Sure,
impact.
sure.
No, so things like that. Again, we focus on precision medicine. I think everybody out there should read about it
Yeah.
and understand what precision medicine is about. And it's just looking at all these biomarkers, following them through time, and making adjustments before the disease happens.
Yeah. You broke it down because I think that the system and its opportunities for guys like you in the business world, the healthcare industry needs to get disrupted for a lot of reasons. But one of them is, like I always said, I go to my doctor twice a year. They maybe do blood, and they kind of look, okay, everything looks good. And like, they never talk to you about nutrition, right? And I got the sense, like, all my doctors in the past, most of them, aren't in good shape like you. And some of them I remember being smokers.
Yes,
Like
completely. Or obese,
nutrition,
or all
like
these things.
I can't get my head around. They don't give you nutrition. They should have a nutritionist at the office.
And maybe it's because of that fact, because they don't do it themselves.
They don't do it themselves, right? You're into it.
Our clinic is an extension of who we are.
Right.
Every treatment that we offer has passed through us.
Right.
Or I do it.
Right.
Like everything. You can ask me, and stem cells. Yeah, I bank them today.
Right.
A PRP. That's how I started. IV therapies. I get one every week.
Yeah.
Like all these things. Ketamine infusions. I do ketamine infusions.
Yeah.
We understand this, and that's the reason for me it's very important to go through them so that I can offer it to the patient.
Let's talk about ketamine. There's a lot of confusion in the marketplace. You do it very differently than you sign up on Teladoc and they send it to you. And you and I have talked about it. It's almost like legalized drug dealing.
Completely.
But you do it in a very interesting way. Walk me through your process.
Right. So first thing is an evaluation. Why are you doing this?
Right.
We know for a fact that ketamine, there's plenty of data and research and conclusive data, that ketamine helps a lot with mental health issues, especially depression, anxiety, PTSD, certain addiction, and chronic pain. So we know that for a fact. So the first thing is to come in for an evaluation, make sure that you have one of these conditions,
Right.
and that we can help you. And we also look at, if you have tried things in the past, what treatments, all these things. We have a psychologist, we have a cognitive behavioral therapist in-house that they go through as well, because we know that the response to ketamine is tied to the psychological component. If we don't do therapy alongside with ketamine, we're not going to get the same results.
Right.
Right. Ketamine is going to basically make traumas more available.
Yeah.
It's going to make it more aware, and also patients can talk about them. We get a lot of patients with past traumas.
Yeah.
We all have traumas. And then with cognitive behavioral therapy, we're able to change those negative and maladaptive behaviors and thought patterns. So that's what ketamine does.
And it's helped with alcoholism and all kinds of stuff, right?
Yeah.
It's crazy.
Yeah.
And this was sort of put in the back burners for years because it was a cheap cheap solution. Big pharma can't make the big money.
Right.
And
It's already a drug that has been approved since the 1960s.
Yeah, the patents are worn
There's no
out.
patent,
Right,
there's
right.
nothing like that. And now with the rebirth of psychedelics in general, we're
Yeah.
finding all these great things. And also we know that the majority of patients that are placed on antidepressants, they don't have a response.
they're on them forever.
That's right.
Right.
So, there's no bridge. It should be, antidepressants were developed to be used as a bridge therapy. Okay.
Right.
You have depression, you have suicidal tendencies. We're going to put you on antidepressants,
Right.
and then we're going to work out a solution, right? And we see patients that have been on antidepressants for 20 years, and they haven't been given any other solution. No?
It's crazy to me.
And also we see, so 1/3 responds to antidepressants. So, okay, they have a role. The other third has negative side effects. And the other third has no response at all. So we're left with 2/3 of the patients that have depression or anxiety without any option, no?
Right.
Besides therapy. So this is another tool in the toolbox.
Who's your typical customer, right? So you have a profile. I mean, almost anybody, obviously, but like, who's coming to you? What, if you had the pie of, here's the split. Is it people anti-aging, somebody with an injury? What does that look like? What's your customer profile look like?
So it's usually patients that are concerned about their health,
Right.
in general, and they're maybe looking for alternative ways because traditional medicine has failed on them.
Yeah, right.
So that's my client in a broad sense. You know, a lot of people get sports injuries, so we get a lot of athletes,
Yeah.
and they have already heard or had colleagues or friends that tried these type of treatments, PRP or natural anti-inflammatories or a more natural approach. A lot, for example, UFC fighters, they can't take a lot of things,
Right.
so they're limited. You know, we have a few UFC fighters that when they're in competition, they can only try certain things. So those are one of the clients that we get a lot, sports and athletes in general. And then we get a lot of retired patients that just want to, continue playing golf, and be competitive and do all these things. We have other clients or patients, they're patients that want to prevent disease,
Right.
very conscious about their health. And I think COVID brought a lot of it, out. We know how fragile we are and how things can change, in 1 second.
Yeah.
So that's kind of like the population in general. I think people that are more conscious about their health and they want to try things that are more natural in general.
Yeah. Yeah, because, most people have been misdiagnosed, don't want to go under the knife. And, as we were talking earlier, which was, man, you're in your 70s and you have a torn rotator cuff. The last thing you want to do, under the knife, physical therapy, blah, blah, blah. If this is another alternative that you go, you get the shot, you do physical therapy, and you're back in a couple of weeks, I mean, that's...
Completely. It's life-changing.
It's life-changing. Your
Right.
quality of life.
Completely. And at 70, like you're saying, the recovery time and
Yeah.
the success rate decreases significantly. It's not the same to have rotator cuff, meniscus
30,
injury,
yeah.
and our, knee arthroscopy and surgeries like that. When you're in your 20s, 30s, you have the capacity to bounce back, rehabilitate, and do all these things. When you're 70, it's a completely different story. So you want to avoid and prevent all these things.
Speaking of completely different stories, doctor, then you become a businessman. When did that pivot happen? When did you say, hey, you know what, I got to break free and I have a passion for this. I want to go ahead and do this.
I think it was a transition. When you believe so much about what you're doing, and we felt the need of something different. Working with others, it was great. I learned a lot, but you feel like you want to take this passion on the road and you want to give it a try. You believe so much in it that you go through the challenge. And it's been a learning process. I didn't do an MBA, and I say I'm paying for it now.
This is better. This is better.
So this is better. I'm going through all those hurdles, and what is satisfying is the people that I'm doing it with. It has brought so much gratitude and also humbleness to my life.
Yeah.
So I'm enjoying the process right now.
So you opened up your second facility, but this facility is a little different, right? It's bigger, and you have physical therapy. Walk me through what happens at the new facility.
Yeah, the new facility is inside a gym. This
Okay.
is a 60,000 square foot gym that they have pretty much every single sport. They have like martial arts, they have basketball courts, they have everything. So we have the patients there or the clientele right there.
Right.
It's convenient for them, it's convenient for us, so we're able to treat them. If they get injuries, they don't have to go anywhere else.
Right.
So they get the treatments right there. If they want to get IVs after the gym session, they go there. So we have physical therapies. I'm there a few days a week for pain evaluations, stem cell evaluations, things like that.
It's amazing that more people don't know about this stuff. But it's the early innings, and I've talked to you about this. This will hit a tipping point that it'll scale
Completely.
quick. And I think the good news is, I think even if you're seeing as the media landscape, mass media, my prediction is going the way of the newspaper, right? The CNNs and this 2-minute segment, and then we got to go to commercial break. Long form podcasters, so Rogan believes in this stuff, Tony Robbins, and the list is long. And then you have scientists and doctors who have their own podcasts that are preaching this stuff, and they can do long form, Substack, Twitter, all this stuff. We'll get the word out, and then obviously referrals, right?
Completely.
I did it, you did it,
And you get the results. That's
you get
it.
the results, and then you spread your friend. The next time your friend hurts their back, their knee, they're gonna go, wait a minute, I don't have to get my knee chopped up and do all this
I have
crazy stuff.
alternatives.
I have alternatives.
And that's the thing. Now you have all the alternatives.
You have all the alternatives. And it's only gonna get better.
Surgery should always be the last resort. For back pain, for knee pain, for anything.
Yeah.
For arthritis, we have all these things that we can do.
And we're quick to go to surgery, right? Like,
Because that's what we know.
That's what we know,
And
say-
you go to an orthopedic surgeon, and guess what?
what's he gonna tell you? Right.
He has surgical solutions.
Right,
I always
right.
say bakers bake, fighters fight,
Yeah.
surgeons do surgery. Man.
Yeah.
That's it.
100%.
So you have to go to other doctors that have a broader type of mentality and have other options as well. And there are.
Give me a couple. So you gave me one prediction about 10, 15 years that we're through stem cells going to be able to create organs. What does the future hold in this industry, in this longevity
There's
space?
a lot of things coming out, man. I mean, it's exciting time to be involved in this. With stem cells, we're going to be able to do great things. Putting those cells in scaffolds and creating meniscus, creating, soft tissue. So replacing it's like going to the mechanic and replacing a part.
Yeah.
It's going to be the same with the body. So this is very exciting. So tissue engineering and bioorthopedics is going to explode in the next few years. We already have a lot of developing on that sense. We're going to be able to just with one single blood drop, get all this information, all these biomarkers, and also detect so many things beforehand.
Really?
So prevention is going to get even better.
It's going to get even better.
Like for Alzheimer's and degenerative conditions like diabetes and all these things, stem cells are going to be able to make a change in that.
Really?
In infections and cancer, cancer is also going to be cured. We're going to have what we call oncologic viruses. So we give you a vaccine, and that vaccine teaches your body to fight these cancer cells. They're already developing that. There's already a lot of trials on that. So
Via your stem cells.
no, well, this is oncoviruses.
Oncovirus,
basically.
got it.
So like getting a vaccine.
Yeah.
Let's say that, there's this cancer that somebody's developing.
Yeah.
And you have a vaccine for that. No, instead of going to the whole chemotherapy and all these things,
Exactly.
we're teaching your body and your immune system to detect those cells and to get rid of them.
That's amazing. Man.
So that and in longevity in general, we're learning all these things about how to live a longer, healthier life. And the person that lives up to 150 years of age has already been born.
You're right. That's
So
pretty amazing.
that's
man.
pretty amazing,
That's pretty
right?
amazing. Yeah.
No, all these things. I'm excited. I'm excited for the future. I think it's a great field. It's just amazing what we're going to be able to do.
That's awesome, man.
And I want to talk about something that is very important and we didn't touch.
Yeah.
And it's hormone optimization and balancing.
Yeah. Okay.
Why is it important to have optimized hormones? And there's a lot of misconception. Before, if somebody was supplemented with testosterone,
Yeah.
oh no, you're using,
No, it's
you're
not the
doing
case anymore.
roids,
No.
this and that. Now we know that that's a fountain of youth for
Right.
men and women.
Right.
There's no reason not to do it. These hormones, they play a key role not only in preventing disease, but also in aging in general.
Yeah.
This detergency of your skin, collagen production, all these things. We know for a fact that when women go through menopause and they stop producing hormones, their skin,
Right.
it lacks
Falls
the
apart.
same composition. You lose collagen. You age tremendously.
Yeah.
And for men, the same thing.
Yeah.
You lose muscle mass. You gain weight. All these things that
Your
predispose you
energy.
to disease.
Yeah.
And that's the thing, energy. There's no reason to live without energy and vitality.
Right.
Right now, we have all these tools. So why not? Oh, no, it's part of aging. To me, that's an outdated theory. That's just outdated saying, I feel bad or I'm tired because I'm old.
100%.
No. You're feeling that way because you're not doing anything about it.
Yeah. Well, remember, I go back to fringe stuff from 25 years ago. So, the bodybuilders, they were overdoing the testosterone, but there was something to it.
Yeah.
Yogis, right? So now it's very common that people do yoga and all this. So people do yoga stretches they don't even know that are original. But breathing is another one. Oh, that's kind of hippie stuff. What are you doing? Meditation. Now it's a huge business.
now
Like
we have
the
data.
fringe stuff that they used to poo-poo it. Now it's like it's everyday stuff. And I think you're right with the hormone therapy.
And
gonna
with
be
hormones,
part
the
of it.
key is like right now you can have the guidance. You don't have to go to the guy in the gym. Hey, listen,
Yeah.
No, man. I
Yeah.
mean, now you can go to a doctor. The doctor can monitor and check your optimal levels and say, hey, listen, this is what you need.
Yeah.
Let's do blood work in 6 months, 3 months. Let's see where you are. And then you tweak it and you optimize it. That's a smart way to do it.
Yeah.
And even for young guys out there that want to get the results at the gym,
Right.
hey, maybe you need better levels.
Better
maybe
levels,
you need
right.
something.
What are peptides? And people take peptides and it's sort of some confusion on it. Can you explain that?
So peptides are, what they are is a small chain of amino acids. So
Right.
it's a small protein that carries a message. We produce a lot of peptides in the body. And as we age, some of these peptides decrease in quantity. And we can supplement the body or we can use them to signal to the body to produce more.
Yeah.
For testosterone, there's a few. Kisspeptin, for example. That's one. We can also use other compounds that are natural to increase the natural production of testosterone. For growth hormone, we have a bunch, what we call IGF-1 analogs. And that's what they are. They're proteins that signal to the body to produce more of something, to maintain that balance or homeostasis, what we call. So they're used a lot for healing. We have one that is called BPC 157. if you want to heal an injury in a natural way, you signal to your body to produce more of these healing, proteins and things in the body. And for sleep, we have some things for sleep, to lose weight, all these things. So peptides, also the future of medicine in a natural way.
It's exciting, man.
It is, man.
Let me walk you through a couple things that are big in the podcast world, and I want to know if they're legit or there's a lot of smoke out there. Things like intermittent fasting. You talked a little bit about it. Why?
Why? Because it induces controlled stress in the cells.
Right.
We know that it activates, and I'm going to talk about longevity
Insulin
pathways.
spikes and all that stuff.
Yeah, it prevents insulin spikes. It activates AMPK, which is an enzyme that is important. It inhibits mTOR. So we can get technical, but I don't want to get too technical.
Yeah.
It induces sirtuin. So it does all these changes in the body that makes the cell very, very efficient. So, that's something that is going to prevent errors in the long term and increase your healthy years.
Cold plunge and sauna.
Completely. It
Completely
works.
why?
Cold exposure, we also know that is one of the things that induces these changes in the cells. So we're looking at the cellular level. Now we understand more and more of this cellular process and what is happening when we induce the cells to these changes. Again, control stress. Just like in anything in life, when you're presented with controlled stress, you grow.
Right.
You get better, right?
Yeah.
It's the same thing with the body. So yes.
You're shocking the body.
You're shocking the body in a controlled manner.
Yeah.
Yes, completely.
Sleep. How much sleep should I get?
8 hours.
8 hours.
7 to 8 hours.
Do I cool the room with temperature? That's another one I've heard.
Completely. Cold temperatures, again, if you're in a colder environment, that tends to be better for aging or for anti-aging, no?
Green juice. Not the green powder juice that they sell everywhere from Athletic Greens, all this stuff. Is that pseudoscience or what do you think?
Well, I mean, if it has good nutrients, I mean, the best thing is always going to get
From eating it.
eaten.
Right.
Right. So the second best option is going to be supplements. So I want to say, if you can get good organic, good food,
right.
that's it. That's your best vitamins and supplements. It's going to be good nutrition.
Got it. I can't let you go without some rapid fire questions.
Let's do it.
You ready?
I'm ready.
All right. The medical TV show or hospital show that gets it right, the most realistic, TV show or movie?
I would go with the documentaries, man.
Okay, because they all get it wrong, right?
They all get it wrong.
They all get it wrong. Good stuff. All right.
Oh, maybe the romantic part and all that drama. That's probably very accurate.
All right. Arepas or croquetas?
Arepas.
Arepas. Is it okay to skip leg day?
Never,
Never,
man. And your girlfriend is going to thank you for that.
There you go. Most overrated health tip?
That's a good one. Probably supplements, I would say.
Really, why? Just there's a lot of crap supplements.
There's a
out
lot of crap supplements. I would say just focus on good nutrition again. I mean, that's the key.
That's the
I
key.
see a lot of people buying all these supplements and then
Yeah.
eating whatever.
Yeah,
It's
these
just
protein powders. You're like, what is
like
in
protein
that thing?
powders, all these things.
Yeah.
Buy the nice salmon, buy something good, and that's it. Man.
And that's it. Yeah,
Yeah.
keep it simple. All right. Stallone or Arnold Schwarzenegger?
Wow, that's a tough
That's a
one.
tough one.
I
I wrestle with that one.
I would say Stallone. I mean, Rocky really hit home.
I love Stallone. All right, one more. You promised me I'm going to live until I'm 100, right?
120.
120. 120. In that span, will I ever see the Miami Dolphins win the Super Bowl?
I can't promise that one.
Exactly.
Maybe if I get those guys on my treatment, yes,
then
probably
they'll be
they'll
okay.
do it.
All right, amigo, where can people find out about your company
So,
and what you're doing?
They can look us up on Instagram. I think it's the easiest way right now. NeoMedicine Institute or NeoMed Institute. Also the website, NeoMedicineInstitute.com. We also have a YouTube channel. You can look us up. That's the best way. And then you'll find all the information.
And even if you're out of state, somebody can do a Zoom
Right,
treatment and send
completely.
you the
We do
blood
Zoom
work.
all the time. We have patients from Brazil,
Okay.
Latin America.
Yeah.
They come and they do all these stem cell procedures because they don't have, this type of technology down there. So, we're always happy to have patients from all the states.
Thank you for coming on the show.
No, thank you so much for having me. It's been so much fun.
Fine. All right, amigo. Take
Thank you
care.
so much, man.